Hi, my name's Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today's Tuesday, May 19th, and this is my daily briefing. We've still only had a total of 41 cases to date in Missoula, so that number hasn't changed. 39 of those were identified by testing, and 2 were epi-linked. We've had a total of 40 recoveries and 1 death, and we have no cases in isolation currently, and that we are no longer monitoring any close contacts. The state of Montana has had a total of 471 cases, which is up 1 since yesterday, and there have been 16 deaths statewide. First, I want to talk about our mobile testing center. On Thursday, our mobile testing center will be in Lolo and Frenchtown. Free testing is available to Missoula County residents and Missoula County healthcare workers and first responders with symptoms of COVID-19, which include fever, cough, shortness of breath, sore throat, chills, muscle pain, vomiting, diarrhea, and new loss of taste or smell. You do not need to have a prescription or a doctor's referral for a test. However, you do need to have an appointment. We're scheduling people for the mobile clinic starting on Wednesday at 8 a.m. Please call 406-258-INFO or 406-258-4636 to schedule an appointment. Those outside of Lolo or Frenchtown, or those who do not want to wait for testing, are welcome to schedule an appointment through our drive-through clinic at the fairgrounds. Tests are available at the fairgrounds this week every day except for Thursday, as Elections is going to be using that space. If you have severe symptoms or you would like to use another testing option, please contact a medical provider or screening center that is listed on our website at missoula.co/cvirus. Next, I want to talk about vaccines. There are several companies that are working on a vaccine for COVID-19. Recently, one company did get approval to move to phase 2 trials. While this vaccine effort is unprecedented in its speed and approach, we're still at least a year off from getting a fully approved vaccine. Why is this? Typically, vaccines take years to develop. Many vaccines use weakened viruses or recombinant technologies, which take a lot of time to develop. The vaccine that entered the phase 2 is using a new type of technology that would create protection using genetic material. Genetic material has not been used for human vaccines before. This approach allows for faster development, but there are still concerns about safety and efficacy. We just need to make sure that the vaccine that's created will actually provide protection and be safe for use. And again, this just really takes a lot of time. Another consideration is the amount of vaccine that is going to be needed. To immunize enough people, we will likely need more than one vaccine and more than one manufacturer. While dozens of companies are working on different products, these two will also need to go through review for safety and for efficacy, which could add to the timeline. When we do get an approved vaccine, the companies will need time to produce it in the scale that is needed, and we will then need to address other needs in our supply chain. Healthcare workers need syringes, vials, personal protective equipment, and possibly cold storage. As we've seen already in this COVID-19 response, basic supplies can be really limited, or manufacturers may not have the ability to scale up as quickly to meet the increased demand. For a vaccine effort to be effective, we'll need a solid supply chain and enough vaccine to immunize a significant number of people in our population. So yes, the recent developments are really promising. Progress is being made on the vaccine front, but we need to be realistic in our expectations. An effective vaccine will not likely be available by fall, but researchers worldwide are working on solutions. In the meantime, each of us has the ability to protect ourselves and our community from COVID-19 by being vigilant and practicing basic measures like social distancing, hand washing, and wearing a face covering in public. The other thing that we need to remember about vaccines is that at this time, we don't know how much of an immune response is necessary to actually protect us from being infected with COVID-19. So that's another thing that is still just being researched at this time. So that's all I have for my daily briefing. Everyone stay healthy out there. Continue to practice those social distancing measures as we continue to move forward with our reopening. Definitely hand washing, stay home if you're sick, wearing face coverings in public whenever social distancing isn't possible. As always, you can subscribe to me on YouTube under my name, Cindy Farr, CINDYFARR. You can follow us on Facebook at the Missoula City County Health Department's Facebook page. You can check out our website at missoula.co/cvirus, and you can call 258-INFO if you'd like to schedule an appointment to get a test done, or if you would like to just get some answers to basic questions about COVID-19, or just want to know what resources might be available for you. So until tomorrow, everybody, stay healthy.